Fish is Chief of the Division of Urgent Care at Denver Health and Associate Professor of Medicine at the University of Colorado School of Medicine. A nationally recognized leader in urgent care medicine, she is passionate about advancing clinical excellence, medical education, research, and equitable access to care, particularly for underserved communities. Lindsey also serves as Editor-in-Chief of the Journal of Urgent Care Medicine and President of the College of Urgent Care Medicine and Urgent Care College of Physicians. Welcome to DX the Podcast, Lindsey.
Thank you. My pleasure to be here.
Yes, excited to talk more as we dive into these questions I have for you today.
Great.
The first time I met you was last year at the UCA Assembly and was super impressed with all the work you've been doing with quality, and it was just really great to meet you. So this is a dream to have you on the podcast. So.
Well, thank you. My pleasure to be here. Happy to always talk urgent care anytime.
Excellent. Well, that's what we're here for today. So to start out, urgent care is a specialty where most patients present with common illnesses. But the consequences of missing the uncommon illness or diagnosis can be life-changing. I know you're deeply passionate about advancing clinical quality. As I just mentioned, that's the first time I met you. That's all we talked about all day long. So as our specialty continues to mature, how does the conversation around quality need to evolve? What are some of the difficult but maybe necessary conversations that we need to be having as a field right now?
So it's a tough field to think about quality. We frequently think about things that are what our patients care about, right? They want cost-effective, efficient, and fast care. But sometimes quality isn't always as fast as we want it to be. And the example I always give is nearly 50% of our visits are respiratory. So pretty common, pretty straightforward, a viral respiratory illness. It's easy to sort of therefore think that everything that walks in our door is a viral or respiratory illness. And it may be. Most likely it is, except for when it's not.
Yeah.
So when I think about why it's so important, it's because of the misses. And the misses are what you mentioned, can really have lasting effects. I always tell the story that when I was young, more than 30 years ago, my mom got sick with a cough and fatigue. And she saw her doctor, and she saw her doctor, and it was viral, and it was viral, it was viral. And then ultimately she went and got a second opinion. And along the way, the doctor had missed her diagnosis, which ultimately ended up being stage 4 metastatic lung cancer.
Wow.
Now, I don't necessarily fault the doctor, because certainly in a 41-year-old healthy, non-smoking female, lung cancer is not going to be at the top of your differential diagnosis. But the reality is I'm always left wondering now as a doctor, if that diagnosis had been made 6 months earlier, would there have been a different impact? And it wasn't just my mom who ended up passing away from her cancer, right? It was me and my brother who were raised without a mother, my children now who don't have their grandmother. And so these things have a long impact sort of down our generations. And in urgent care, I think we often miss that because we're not part of necessarily a system. And so it's not easy to see the misses, to realize and to learn from them. They're going to happen, but we got to be able to learn from them. We've got to create systems where making sure we're giving really good care every time is as important as being efficient, being quick, and being cost effective.
Yeah, so recognizing that own personal story of yours and how you can kind of play the tape forward and impact the field as a whole, I think is really where I see that passion of yours come out anytime I've been around you. So I appreciate that, and I appreciate you for being so kind of real about your story and what your background truly looks like when it comes to your experience with healthcare from a very young age.
Yeah, my pleasure. And I think, I do quite a bit of expert witness work for urgent care, and I just see the same thing. That's the sad part, is you just see this pattern of if somebody had caught it earlier, if somebody had taken 3 extra minutes to think about something or made a slightly different decision, what could that have looked like, not just for the patient, but their family, their children, their grandchildren.
So waking up daily and saying the time is now, and we must keep moving forward to improve the field as a whole.
Absolutely.
For sure. Well, and thinking of that and just kind of the training that clinicians have in the urgent care space, one thing that, we've talked about in our clinical kind of pathway through the assembly, as well as something that I think you think about most days, if not every day, is the fact that physicians typically complete more than 10,000 hours of supervised clinical training before practicing independently. So you and I both went through that rigor. But there are other members of the care team, nurse practitioners, PAs, many of which are in the urgent care space, and they followed very different educational models to get to their role today. So from the patient's perspective, however, the expectation is the same, right? I walk through the doors and I expect to get excellent quality care. And really the thought is that every clinician should be delivering safe, high quality care and sound clinical judgment. So how do we get there? How do we ensure that every clinician in every space and every urgent care is prepared to make these high stakes decisions, recognizing that sometimes it's within like 5 to 10 minutes or less?
Well, you touched on it exactly there. The key point is making the right decision quickly.
Yeah.
You don't have to come to the final diagnosis. You don't have to, but you got to make the right decision about that patient. And so I think, physicians even have gaps in that. I'm by training an internal medicine doctor, and I work obviously with a lot of emergency medicine doctors, for example, and they're like, we can do urgent care. And I'm like, you don't know how to do a belly pain without a CT scanner.
Exactly.
Right? And so we all have gaps in our training.
Yes.
Physicians, nurse practitioners, physician assistants alike.
Or a different approach in the patient coming through the door.
Right.
Yeah.
And so I think that's actually where the gap is that we need to identify. And it might be by training, it might be by physician and PPA, it might be by experience, 10 years, 5 years, 1 year, no experience. But I think what we've got to do is actually figure out how to identify what that gap actually is. Yeah. And this is where I really think, urgent care as a field is different from any other specialty in medicine. Because it's not about coming up with the craziest diagnosis like maybe an internal medicine doctor would, right? Sure. And it isn't about placing a chest tube like an emergency medicine doctor would. It's really about that gap in between, that understanding of how do I listen, how do I do an exam, and make the right call about this patient. And the right call sometimes is go to the emergency department, and the right call sometimes is here's your Tamiflu for influenza, right? But it's about really identifying what that gap is and how to close the gap. So I think personally, we need better training for physicians in some of that clinical reasoning, depending where they come from. We certainly need better training for physicians who are overseeing, both directly if they're in location or if they're remote, our advanced practice clinicians. And we absolutely need better training for our nurse practitioners and physician assistants to help close that gap. It's an absolutely unreasonable expectation to think that a new graduate nurse practitioner who had a variable clinical experience, maybe a few hundred hours of it, is going to be successful at not making the miss we just talked about.
Yeah, so it's coming alongside and recognizing that linking arms is necessary for everyone. It's just a matter of different approach depending on your experience, your education, et cetera. So absolutely. All right. Well, talking about next steps and kind of technology and the ways that technology has impacted healthcare, and not just urgent care, but healthcare as a whole. You have previously said something that really stuck with me. You said technology should enhance clinical reasoning, not replace it. So as we're talking about gaps in education and making the right decisions, so where do you see AI creating the greatest opportunities in urgent care? And where do we need to be careful not to outsource actual clinical judgment?
Yeah, well, I am by no means a technology specialist, so I defer to people much smarter than I am in that. But I think my comment comes from having used an AI scribe. And what I realized when I did that was, it was great. I had a history and a physical and a note. But then when I was looking at it, I was spending my time editing the note to make sure that it didn't have misspellings or said something wrong. And what I actually use my note writing for is thinking and clinical reasoning. And I lost that when I had a note already drafted for me. So when I think about, when I'm thinking about a chest pain, when I'm writing the history up, I'm thinking to myself, did I ask about, recent travel because of a PE? Did I think about, did I ask the questions of quality, duration, all those things to identify risk factors for, an acute coronary syndrome? And if I just had a list of things I never caught when I forgot to ask the question I needed to ask to consider the diagnosis. And at the basic core, our patients are not machines. And so algorithms can be really helpful, but people aren't algorithms. And gut goes a long way. And AI doesn't pick up on gut. It just doesn't. And so I think what we need to really understand better, that I'm not sure that we do, is really how clinical reasoning happens and how to best facilitate it. People spend a lot of time, as I mentioned, on documentation. That's a huge complaint and a lot of time. And maybe in some fields or in some complaints, that isn't a necessary part of clinical reasoning. But in an undifferentiated patient that you're seeing every single time in urgent care, I think that is. And I think documentation for a lot of people is part of how clinical reasoning happens. So I think we need to know better about how the human brain works and how AI can best support that. Again, when you take algorithms, if they give you a list of a differential diagnosis, that's great. And I'm not sure that it includes everything, right? And I'm not sure that it's going to catch the nuance of the patient or the gut instinct that the clinician had when they were interacting with them. So I think we actually need to better understand clinical reasoning, how it actually works, and figure out how technology can actually support it. I think we get a little lost sometimes on sort of the day-to-day,
Yeah.
right? The charting, the billing, the whatever. But there are pieces of that are just so important for how we do our clinical
So
reasoning.
instead of focusing on solving a problem for solving that problem's sake, it's like really get to the root of what is best for the clinical situation, for the patient, and for the clinician that's actually using the tool. So finding that right balance between the tool helping, ease documentation burden, et cetera, but also recognizing the need to keep that art of medicine in the mix of it all.
I mean, that's what people say all the time. They're like, well, how did you know that? I'm like, just had a gut.
Yeah.
A gut thing that told me to ask this question or do that test. And AI is not going to algorithmically give that to you.
Yeah, so bringing the two together to the best way possible.
Yes.
All right, well, to close out, let's switch gears with what I'm going to call your rapid fire round of some quick questions.
Gotcha.
I'm going to throw out a few questions, and I just want you to answer with the first thing that pops in your head. So, You ready for this?
I guess so.
Okay. What is one symptom that will always make you pause?
Shortness of breath. I'm in Denver.
Oh, yeah.
Shortness of breath could be anything. So
Mountain
you always got to
medicine.
pause. Yeah.
What is one habit that separates good clinicians from great ones?
Making a differential diagnosis and documenting it.
Love it.
That is my number one. I say it 1,000 times to all our learners. What's your differential diagnosis? Because just too easy to walk out the room and say, this is this. You did not make a differential diagnosis.
What is one quality metric that you believe is overrated?
Well, I will tell you, I know I'm supposed to be rapid fire here, but I think that length of stay is overrated and it's not actually a quality metric. It's a patient experience metric. It's not actually a quality metric.
So putting it in the right category would make a whole lot more sense.
I think we need to, we certainly need operational metrics
Yeah.
to show success. We
Yeah.
need financial metrics to show success, but true clinical quality metrics, we have very few of in urgent care.
Yeah.
We're working on it,
Yes.
but we're not there yet.
What is one question every clinician should ask their patient?
Is there anything else I can do for you?
Oh, that's such a hard one.
I know, because you want to be 3 to 5 minutes, but
I love that that's your answer, though.
Really, it's that or do you have any other questions,
Yes.
right, about
Yeah.
what I've explained to you? I think, again, in an effort to go fast, we lose the human connection and we fail to always make sure that our patients truly understand what's going on for them and what they should do if it doesn't work out for them.
Absolutely. All right, last one. What is urgent care's biggest opportunity?
Well, I'm a physician. I believe our biggest opportunity is to create urgent care as a new specialty of medicine and a recognized specialty of medicine.
Awesome.
That would be the dream.
Yes. Well, thank you so much, Lindsey. This was a blast. I really enjoyed having you on the podcast, and I can't wait to invite you back again, and we can chat more about everything you know and all. So appreciate it.
Thank you so much.
Yes.